Okay, welcome back to 3+U. It's been a topic that we've been discussing a little bit on the show this week. Carpal tunnel syndrome, whether you're typing at a computer all day, maybe out throwing a ball, doesn't matter. So many people end up with these sudden pains in their wrists, carpal tunnel. Well, welcome to the rescue, Dr. Nick Circolone, whose new branded name is Apple Chiropractic Orthopedics and Rehab.
Yes.
Because you are a chiropractic orthopedist.
Yes.
Welcome.
Thank you.
Okay, so I told you we've been discussing this before, and during the week we had neurologist Josh Alpers on with his ultrasound machine. You're very familiar with that.
Yes.
Your philosophy, though, is you can maybe do some things non-surgically that will work.
Yes.
Why not try that first?
You know, for anything from trigger point therapy to traction of the carpal tunnel, these things work well, not for everybody, but they work well for a lot of patients. Okay. And I'm a firm believer that if you're going to have surgery, if it's necessary, then you're going to have surgery.
Right.
But if you're on that fence a little bit and you're not sure whether or not surgery is going to be for you, try something non-invasive. If it works, that's wonderful. You don't have to have surgery. You can always get surgery, but you can't go backwards sometimes. And that's the hardest part. Okay,
it's kind of a, not I'll say an overused phrase, but we use it a lot. Oh yeah, you're getting carpal tunnel. What is it exactly?
There's called a retinaculum, and what goes through there is that there's a retinaculum. It's a band that's around your wrist.
Okay.
And the median nerve goes through there, and it becomes compressed.
Okay.
So what they'll do is they'll do the surgery where they'll release that nerve in order for there to have area around there, so there's no compression in that area.
Okay. Enter you, because you can do decompression in that same area.
If there's not too much damage in there, if there's not too much arthritis in there, we can get the swelling down, we can either use a traction, which we have a traction machine that'll actually do that. We can physically do it, but we have to test it. You know, carpal tunnel is pretty easy to find. Usually we'll do the ultrasound, you can do ultrasound on it, or you can find it with EMGs. Well, right now, once you find it, what do you do with it? Do you go right to surgery, or do you try something less invasive in order to decrease the chance of possibly having that surgery? Okay. And that's where I come in with all of that.
And there are people out there maybe who have been to see a medical doctor and they're considering surgery, and the insurance kicks it back and says, we're not going to cover surgery right now, try something different. And people can then come to you and not have to go through the surgery at all, possibly.
Sometimes. And you know, that's the beauty part of what we do in our office. We work together with other doctors. If there's something I can do, let's do it. If there's something I can't do, let somebody else do it. I'm not trying to say you can never have surgery. This is the worst thing possible. You know, we need to find a good, happy medium for our patients in order for them to be able to have options other than I'm going to get surgery or I'm going to have manipulative therapy and that's it. Okay,
so how do you know that you are getting it? And does it build slowly so that early intervention is key?
Well, it's one of those things, there's symptoms, which you look for. A lot of times people will have symptoms, radiation into the hands. Sometimes it's very intense. It feels like somebody drew a knife right down into the hand. They can't close their hand. They can't grip. It's impossible for them to open up a jar. When we get to that point, that's more of a surgical intervention.
Okay.
But if you're having tingling, sometimes you might, at night, we can put a brace on there. We can do manipulative therapy. We can do decompression. But what we don't want to do is get to a point where you're starting to lose muscle strength, grip strength rather, and you're starting to see actual changes. The muscles start to atrophy in the hand. That's surgical intervention at that point.
Okay. We all kind of know it can happen at a keyboard typing. Mm-hmm. What are some other causes of it, or is it a genetic thing? Are you just prone to developing it?
You know, that's hard to say. Some people are more prone to it because of their jobs, I think. You know, mechanics where they're turning wrenches all the time, typing at a computer, working where you're using your hands constantly, repetitive strain. Carpal tunnel is in the family of repetitive strain injuries. If the carpal tunnel is in fact a problem, then we look at it and say, okay, it's down in that area where it's being compressed. Could it be compressed at a nerve, when we talked about this at another show one time, up in here where we can do a trigger point where we can relieve some of that tension? It all depends on where it is that we're causing this. Basically, a flow is slowed down, and that's why the nerve has pain.
Okay, sadly, we tend to be an impatient society these days. So,
all the time.
There is a wait-and-see approach with physical therapy. How long does it typically take to see if this is going to work? If it's an early stage
If in
case?
early stages, we know pretty quickly. It's one of those things where in the first 2 to 3 visits, you'll know if it's working.
Okay.
It's not something that has to be drawn out over months and months and months. A lot of times, once we realize what's causing it, once we find out what's been the problem, then we can give you some exercises. We can brace you. We can basically take you out of the game with doing certain things, because there's a lot of braces that you can use and still do your job.
Okay.
So if we can ease up on that inflammation in that area with anti-inflammatories, with bracing, with physical therapy, with chiropractic, all of those things come into play, and patients can get better on their own, and nutritional supplements as well.
He's a one-stop shop right there on Shallowford Road. Apple Apple Chiropractic, Orthopedics, and Rehab.
There you go.
There you go. That's the words for you. 855-7376, applerehabgroup.com. Still the website.
Yes.
Check out his terrific staff, nurse practitioner on site. They will get you feeling better, no matter your concern, in no time. Good to see you, Nick.
Always good seeing you.
We're
Thank
back
you.
after this.